give me a quick overview of some of the products that you handle and send out from the blood bank.
So there's red blood cells, there's plasma, cryo, and platelets.
Okay. When you say cryo, you're talking about cryoprecipitate.
Yes.
Okay. So the red blood cells we need because
we have a low H&H anemia, bleeding out.
Yeah. So the red blood cells, they transport oxygen for us.
You just went very basic all of a sudden.
We got to go very basic.
Yeah.
So we're talking to the people that have
true.
potentially no medical background or knowledge whatsoever. So
okay.
just that's why I go super basic. Yeah. So and maybe my knowledge is super basic too, especially compared to you. So oh yeah, really. So red blood cells transport oxygen using hemoglobin. That's why they're red. And when you're bleeding, by any means, so you can bleed externally or internally. Sometimes we can see the bleeding, a lot of times we cannot, and we have trouble locating it. What she says with an H&H is a hematocrit and hemoglobin level, which gives us an idea of what exactly?
Well, I guess we just know that there's a normal level of hematocrit and hemoglobin, and then there's a critical, so less than 7 is a pretty good standard, at least for Arizona.
Okay.
Less than 7 is considered critical, and you potentially should need blood products unless you can stabilize on your own, or it's proven that you can stabilize on your own, and then it's kind of up to the doctor and up to you as a patient if you want to get transfused.
Yeah, and the end rationale behind the transfusing for those critical levels is if you do not have enough oxygen capacity in your blood, then your organs will become oxygen starved eventually. So we want to transfuse you to make sure that you have enough perfusion, enough oxygen going to your brain, going to your kidneys, your heart, your lungs, all of your vital organs. So that's red blood cells, and then we have platelets.
Platelets, so people that you can see with low platelet count, it could be they have like an autoimmune problem where their body actually attacks their platelets.
Yep.
And we can give those patients platelets, and sometimes the doctors will decide to give those patients platelets, but ultimately their bodies can still attack the platelets that are in them. And then also just equilibrium. So if I'm giving a patient 4 units of RBCs, they should also probably need a unit of platelets just for equilibrium.
Yeah, and we also usually give plasma.
And plasma.
Yeah, and yeah.
So platelets coagulate on the surface of like a scab or something that you form. You form a scab because of platelets and because of coagulation factors. So there's different coagulation factors in FFP. And
she's
that's
talking about plasma here.
Yeah, in plasma. And then there's different coagulation factors in cryoprecipitate. So it's 2 different coagulation pathways that we have in our body. And so we can therapeutically give plasma or cryo in order to counteract the coagulation issues that the patient's experiencing.
Yeah, and those 2 products that you're talking about pretty much save people's lives with, congenital bleeding disorders.
Von Willebrand is cryoprecipitate, and I think factor 8. I always get confused, but I think there's factor 5 or factor 8 in plasma, and then I know for sure Von Willebrand is in cryoprecipitate.
Yeah.
But
yeah, so some people are born with disorders where their bodies can't make the clotting factors, or they make no clotting factors at all, and they're at a very high risk of bleeding with very little insult. So if they fall down, for example, very high risk of bleeding internally or externally. If we want to draw blood from them, that would also put them at risk for bleeding.
Probably a traumatic experience just to get their blood drawn.
Yeah, yeah. So these substances are incredible introductions. Do you know by chance any of the history behind them, like when they came about?
Oh, separating them, or how they determined to separate them?
Separating them, using them.
I think separating them was just a methodology of preserving them. I think that I think it was Red Cross who figured out how to separate them and to preserve them. But there's actually a lot of medical literature out there about giving whole blood too, and when I say whole blood, I mean blood that has been donated but still contains all the factors and has not been separated out.
Sure.
So in the United States, we still separate them and give them separately. But like in Europe, they have started giving whole blood, like say to car accident patients that have lost a lot of blood. If you gave them whole blood, then they're potentially getting balanced amounts of RBCs, plasma, platelets, and cryo. So if I get a trauma patient now in our hospitals in the United States, you're going to get all 4 products.
Okay, and do we separate them because they preserve better?
Because of a way to preserve them, and I guess a way to measure them, because we've standardized a unit of platelets will increase your platelet count by X amount. Like 1 unit of RBC should increase your blood, I think, by 1 gram or 2 grams. And when I say grams, I mean grams of hemoglobin, or one point. So if you're at a 6 and I transfuse you 1 unit, you should increase by 1 gram of hemoglobin from 6 to 7. Hopefully, potentially, depends on your body.
Sure. So this is actually a really interesting point you brought up, because it has to do with how we collect data and utilize that data in medicine. And so if in medical practice you separate all of your blood factors, you separate the red blood cells from the plasma, from the cryoprecipitate, from the platelets, then when we're studying the effectiveness or utilization of these products, that's all the data we have to draw from. So if we're not doing whole blood transfusions in the United States, then we're not going to have data to back up our evidence-based practices with. That's really interesting. I never thought about that before. And so how long do you know how long whole blood preserves for?
So that's standardized. The life of a red blood cell is about 3 months or 90 days.
Yeah.
So there's a calculation made, and I think that it's from the point of donation. It lasts about 2 months, I believe, is the expiration date that's given on red blood cells. Because there's no preservative that can prevent a red blood cell from carrying out its proliferation or the 3 months time frame. So it's 3 months.
Okay. And then when we separate red blood cells, does that extend the preservation time? No, because they're programmed for cellular death. All right. What about the plasma, though?
So when I say FFP, if you like that acronym or abbreviation, fresh frozen plasma, it's almost like jumbo shrimp, right? If you think fresh. Okay, so fresh frozen plasma, we freeze it, and it's good for a year frozen. But once I thaw it, it's good for 5 days.
Okay. And how long does it take to thaw?
20 minutes.
All right. All right, cool. And then cryoprecipitate?
That is also a year frozen. So I pull it out of my freezer, and it's frozen at like negative 20 degrees or less than that. And then it takes me 5 minutes to thaw it. But once I've thawed cryoprecipitate, I think you have 6 or 8 hours, and it expires and I have to throw it away. Wow. So when I'm talking to a nurse or a provider about giving cryo, I probably annoy them because, are you sure you're going to give this cryoprecipitate? Because I'm going to thaw it. You need to tell me when I'm going to thaw it, because you have 6 hours after that point to transfuse it. And then I've wasted this cryo that could be living in the freezer for another 8 months. Yeah. You know.
And what about platelets?
Platelets are a tough one. We always have a national shortage on platelets because platelets only last a few days.
Okay.
So as a blood banker, we're constantly notified by United Blood Services, which is our major provider in Arizona. We also have the Red Cross, but our major one on this side of the country is United Blood Services. But every day they update me on how many platelets they have that expire by midnight that day. And typically it's probably 15 to 20 units of platelets that we just throw away every day.
Wow.
So as a state, when I say we.
Okay.